In this video, we're going to demonstrate the straight leg raise. This is a really useful test for assessing the hamstring length, especially in clients that are experiencing generalized lower back pain. Ideally, with this test, we want to be able to get the leg to about 90 degrees because normative data shows that we've got a 90-degree angle at the hip, then we've got a good range of motion, and then generally that shouldn't contribute to generalized lower back pain. We can do this test in a couple of different positions for the foot. We can have the foot in a relaxed position, or we could also have the foot in a dorsiflex position with the big toe in an extended position. So to demonstrate the relaxed foot position, essentially from here, I'm going to take hold of around the ankle area and feeling for resistance in the hamstrings. I'm then going to bring Katie's leg up to roughly about 90 degrees, or I'm going to stop whenever I feel resistance. So if Katie's leg got to this position and there was resistance and she couldn't go any further, so we often see flexing at the knee in this instance when we've got to that maximal length in the hamstrings, or we might see the lower back coming off the couch. So in that instance, that would tell us that this is a positive test, meaning that she's got reduced flexibility in the hamstring area. However, if we can get the leg up to about a 90 degrees position, then this is going to tell us this is a negative test because we've got a good range of motion at the hip joint in hip flexion, which means that the hamstrings have got sufficient length there. Okay, if our client was still experiencing generalized lower back pain or any tension in the back area and we had the leg at 90 degrees, then we could put additional pressure into the hamstring region or into that posterior chain by taking the foot into a dorsiflex position and then extending that big toe. So we would do that at the start of the test by taking the foot into dorsiflexion and also extending that big toe. Then from here, maintaining that foot position, we're then going to bring the leg up to about 90 degrees, or we're going to see how high we can get this leg. Okay, so in this instance, this would be an example of a negative test. We've increased the pressure on that posterior chain, but we're still able to get that good 90-degree angle at the hip. If this was as far as we could take the leg, then that would be our example of a positive test. Okay, so that was our straight leg raise, which is useful for assessing the length of the hamstrings. And we can do this test either with the foot in a relaxed position or the foot in a dorsiflex position with the big toe in an extended position.